Every day I walk away amazed. The CDC headquarters has been largely empty during the COVID-19 outbreak. In accordance with national guidelines, most CDC employees have been teleworking as part of social distancing efforts to prevent the spread of the disease. But a handful of staff remain in the agency's Emergency Operations Center, or EOC, and they're there from day to day. And for 3 months, one of them was Dr. Dana Maney Delman. Dana served as one of the principal deputy incident managers, working closely with incident manager Dr. Jay Butler, who until recently led CDC's response to the outbreak. And while the rows of empty desks in the EOC are a stark reminder of the ongoing pandemic, the CDC has a team of what they call really talented rock stars that work tirelessly to protect the public, Dana says. This response has been challenging for many reasons, but particularly because there are so many unknowns about the spread and effectiveness of prevention strategies. Dana says, and the response is complex. We have to coordinate with other agencies in other parts of government. But every day I walk away from the EOC amazed at what our incredible staff can accomplish and their dedication, motivation, and innovation. From patient care to public health. If you sit down and talk to Dana, it is obvious that she is a New Yorker. She spent her first 30 years in Long Island. Her interest in medicine began in high school while working in a physician's office. She jump-started her career after high school, being accepted into a combined college and medical school degree program at SUNY Stony Brook School of Medicine. After medical school and residency, she spent 12 years working as an OB/GYN in private practice and in academic medicine before she became interested in public health. She continues to practice clinically at Atlanta's Grady Memorial Hospital and works as part of adjunct faculty at Emory University. While working at MD Anderson Cancer Center in Houston, Texas, Dana was asked to write clinical guidelines for treating cancer in pregnant people, which ultimately inspired her interest in public health. Before that experience, I had never really considered public health as a career path, because I did not have much exposure to the field in medical school or during residency, Dana says. I always viewed myself as a clinician with a passion to take care of individual patients, particularly those from underserved areas. But Dana noted that a lot of what OB/GYNs do every day is core to our public health. We screen for many diseases and conditions, and we promote prevention throughout the lives of women, she says. So in 2005, she decided to pursue a master's in public health while continuing to practice medicine and teach medical residents and medical and nursing students. While completing her MPH, she began working at CDC as a contractor, eventually joining their agency full-time in 2012. A veteran of emergency responses. COVID-19 is the 7th response that Dana has worked on. She participated in smaller emergency responses and played leadership roles in other responses like Ebola and Zika. For Zika, she was deployed to the CDC Response Center before the EOC activation and stayed with the response through the entire activation. Her clinical expertise as an OB/GYN was essentially critical for Zika. Zika can result in birth defects among children whose mothers had the Zika virus infection while being pregnant. Her most recent experience before COVID-19 was leading the agency's response to the outbreak of severe lung injuries that had been linked to the use of e-cigarettes. At the beginning of the COVID-19 pandemic, she helped the CDC mobilize the EOC and stand up the incident management structure for a coordinated response. She recalls that at the end of February, when it was pretty clear that this was going to be a pandemic, I remember feeling an intense duty to serve. Dana says, I was a little intimidated about what we were going to face, but we had done our many dress rehearsals, and the CDC needed leaders throughout the agency who had response experience. Helping people do what they do best. On the COVID-19 response, she met regularly with response leadership and task forces addressing different facets of the outbreak. Consults with outside experts that the CDC typically taps for advice, and fosters cross-coordination and discussion of emerging issues within the response. She viewed her role largely as helping CDC's incredible staff prioritize and encourage and help people to do what they already do best. We will get through this, she said, as she rotated off the response at the end of June. We can't pretend it's not a very difficult situation, but we will get through it together, Dana says. The CDC has provided the best recommendations and guidance, and we will continue to do so based on emerging scientific evidence. The American people are listening and continuing to do their part to minimize the effects of this pandemic.